Welcome back to the deep dive. I want to start today with a question that I think, honestly, divides humanity into two very distinct, almost warring camps.
Oh, I think I know where you're going with this.
It's a question that, it always comes up when you're booking a vacation or a business trip, and you're just staring at that little digital seat map on your screen. You're trying to decide where you're going to live for the next 6 hours. So the question is, when you get on a plane, are you a window person or are you an aisle person?
Oh, that is the classic travel debate.
Hmm.
It is right up there with checking a bag versus carry-on only.
Exactly.
And for most people, I think that answer is based purely on, lifestyle preference. Do you want to lean your head against the wall, pull the shade down, and just sleep without being disturbed by the beverage cart?
Right. You're a window person.
You're a window person. Or do you want easy access to the bathroom without having to climb over two sleeping strangers like it's some kind of jungle gym? Then you're an aisle person.
Exactly. It feels like a preference,
Yeah.
right? It just feels like a minor comfort choice. You're weighing the view against, well, bladder access. But what if I told you that for a specific group of people, specifically people dealing with heart issues or carrying certain risk factors,
Yeah.
that choice isn't about the view.
Hmm.
It isn't about comfort at all. It could literally be the difference between life and death.
It sounds so dramatic when you put it that way. And I know our listeners might think we are, engaging in a little bit of hyperbole. But
Yeah.
when you really look at the physiology of what happens to the human body at 30,000 feet, you were absolutely right.
Yeah.
For someone with heart disease, choosing that window seat could essentially double their risk of a life-threatening event.
Double the risk just by picking the wrong seat. That is a staggering statistic to open with, and that is exactly where we're going today. We are taking a very, very high-stakes look at heart health. But we aren't just doing the standard eat your veggies and go for a run talk. We are looking at heart health from two very specific, very practical angles that I think most people just ignore until it's way too late.
Right. We're looking at it from 30,000 feet in the air inside what one of our sources calls the flying sardine can.
Which is perfect.
And then we're going to bring it right down to the ground and look at it from the perspective of the clinic door. How you actually navigate the medical system when your heart starts, acting up.
It's a really smart combination of topics because they both deal with logistics. I mean, one is the physical logistics of moving your body safely through the world, specifically through the, well, hostile environment of air travel.
It really is hostile.
And the other is the medical logistics of understanding how your heart is wired and how to find the right mechanic, so to speak, to fix it.
I love that. The mechanic.
Yeah.
We're going to abuse some car and plumbing metaphors today. I can just feel it.
Oh, absolutely.
But it works. The heart is a machine. It's got pipes, it has wires, and it absolutely requires maintenance. And just like a car, it performs differently under stress, like when you drive it up a mountain, or in this case, fly it across an ocean.
It is a machine, but it's a machine we can't just trade in for a newer model when it starts making a funny noise. So let's introduce our stack for this deep dive. We've pulled together some really fascinating material.
Yeah, we have.
First up, we have a broadcast from the Dr. Jeffrey Tauth Heart Talk Show. And let me tell you, this guy is a character. He's based out of Hot Springs, Arkansas, and he has this very folksy, very no-nonsense way of explaining these incredibly complex medical concepts. He describes one of his episodes as juicier than your cousin's peach cobbler.
Which is a fantastic way to describe medical advice. It just immediately disarms you. But you're right, don't let the folksy charm fool you. Dr. Tauth is incredibly serious about patient education. His core philosophy, and this is really the thread running through everything we're discussing today, is that prevention beats treatment every time. He's looking at the risks that patients often ignore until they're, in the emergency room. He wants you to be the smartest person in the room about your own health.
Right. So we are using his broadcast that's specifically focusing on travel risks. And then to round that out, we are combining it with the Heart Rhythm and Cardiology Patient Guide, which is this really comprehensive resource that breaks down arrhythmias, the electrical side of the heart, and gives us a roadmap for navigating the different types of heart doctors.
So our mission today is really to equip you, the listener, with a flight plan. We want to unpack the plumbing of the heart, circulation, clots, all that scary stuff, and the wiring of the heart, which is the rhythm and the electricity.
Okay, let's unpack this. We're going to start with the plumbing, and we're going to start with that flight. We take it for granted. You buy a ticket, you sit down, you watch a movie, you eat the pretzels, you land. But physiologically, something weird happens to the human body when you strap it into a seat and shoot it into the sky for 8 hours. We aren't really designed for that, are we?
We really aren't. Not at all. And to understand the risk, we have to talk about something called deep vein thrombosis, or DVT. Now, most people have probably heard the acronym, maybe on a billboard or a pharmaceutical ad, but they might not know the mechanism. In the general population, this strikes about 1 in every 1,000 long-haul passengers.
Which, to be fair, 1 in 1,000 doesn't sound like a panic-inducing number. If I bought a lottery ticket with 1 in 1,000 odds, I probably wouldn't quit my job. I'd think, it's pretty unlikely.
Right. For a healthy person, it's a risk, but it's a manageable one.
Sure.
But, and this is the big but, if you have heart disease or significant risk factors like a history of smoking or obesity, that risk multiplier just kicks in. You are facing 3 times the risk of the average person.
3 times. Okay, that changes the math significantly. That goes from unlikely to statistically concerning.
It does, because your circulation is already compromised to begin with. And then you put yourself in an environment that is designed almost diabolically to stop blood from moving. Dr. Tauth uses this vivid imagery. He calls the plane a flying sardine can.
It certainly feels like that in economy class. I mean, you're wedged in there, your knees are hitting the seat in front of you, you can't really extend your legs at all.
You're completely immobilized, and in that can, your blood flow changes. To understand this, we have to visualize how blood moves. Arteries are, well, relatively easy. The heart pumps, and the pressure just shoots the blood out to your toes.
Right.
But veins have a much harder job. They have to get the blood back up to the heart against gravity.
Right. It's an uphill battle.
Literally.
Yeah.
It's an uphill battle.
Yeah.
And veins don't have a big pump like the heart attached to them. They rely on the muscle pump. When you walk, your calf muscles contract and they squeeze the veins, pushing the blood up. But when you sit in a sardine can for 8 hours,
the pump is turned off.
the pump is off. Exactly. Think about a river. When a river is rushing down a mountain, it's clear, it's fast, nothing settles, it just carries everything with it. But when that same river hits a flat delta and slows way, way down, it becomes a lazy river. Silt settles. Mud forms at the bottom. That is essentially what happens to the blood in your legs during a long flight. It pools. It becomes stagnant.
And when blood pools, it clots. That's just the basic physics of biology. It's trying to, scab over, basically.
In a sense, yes. The clotting factors in the blood start to bind together because they aren't moving. And it forms a clot in the deep veins of the leg. That's the thrombosis part of DVT. Yeah. Now, having a clot in your leg is painful. It can cause swelling, redness. But the terrifying part isn't just that it's in your leg. It's that it can break free.
This is the moment where the horror movie music starts playing in my head.
It is. It creates this little torpedo that travels up through your bloodstream. It goes up the leg, through the abdomen, through the right side of the heart, and then it gets pumped out to the lungs.
Oh, wow.
But the vessels in the lungs get smaller and smaller and smaller, and eventually that clot gets stuck. That is a pulmonary embolism, and that blocks the oxygen exchange. It is often fatal, and it happens incredibly fast.
That is a terrifying sequence of events. And Dr. Tauth, he mentions a specific danger zone for this. He says any flight over 8 hours is the critical window.
That's the threshold where the blood, essentially, as he puts it, takes a vacation from proper flow.
I love that phrase, though I hate the reality of it. Taking a vacation from flow.
Exactly. The blood is just lounging around. Below 8 hours, the risk is there, but your body can usually handle it. Once you cross that 8-hour mark, think, New York to London, LA to Tokyo, you were in the red zone.
But it's not just the time in the seat, is it? It's also who is in the seat.
Correct. It's a combination of factors. We call it a perfect storm. If you're over the age of 60 and you're on heart medication, you are already dealing with a pretty complex internal environment.
Sure.
Dr. Tauth describes mixing those factors, age, meds, and altitude, as mixing a hurricane with a tornado inside your bloodstream.
That is a terrifying weather report for your arteries. But why does the altitude specifically matter? I mean, is it just the sitting or is it the air itself?
It's both. Let's talk about the air. You know how your skin feels dry, your eyes feel gritty when you fly, you feel like you need a gallon of lotion when you land.
Oh, yeah. It's like being in a kiln or a desert. I feel like a dried apricot by the time I land.
That's because it basically is a desert. The humidity in a plane cabin is incredibly low, often around 10 to 20%, which is drier than the Sahara.
Wow.
So that causes dehydration rapidly.
Yeah.
You're exhaling moisture with every single breath, and it's just evaporating off your skin.
Yeah.
And when you get dehydrated, your blood volume changes, the liquid part. The plasma decreases.
So the ratio of solid stuff to liquid stuff shifts.
Exactly. The blood becomes more
It's
viscous.
viscosity. That's the thickness, right?
Yes, the thickness. And Dr. Tauth has this great comparison. He says, healthy blood should flow like a mountain stream. Fast, fluid, easy. But when you get dehydrated on a plane, it turns into molasses in January. Or even peanut butter.
Peanut butter running through your veins. That is a visceral image. So, okay, you have peanut butter blood sitting in a lazy river in a sardine can. It's just sludge at that point.
It is sludge. And then the final piece of the puzzle, you chose the window seat.
Right. Bring us back to the window seat. Why is that the nail in the coffin? Is it just that you're trapped?
That's what I call the excuse factor. If you are in the aisle, you have autonomy. You can stand up whenever you want. You can stretch. But if you're in the window, think about the social dynamic. You have to ask the person in the middle seat, who then have to ask the person in the aisle. Maybe they're sleeping. Maybe they have their tray table down and a laptop open, and they're in the middle of some important work.
And nobody wants to be that person. You don't want to wake up the grumpy businessman in a 14C.
Exactly. You don't want to be annoying. So you rationalize it. You say, oh, I'll just wait until they get up. But they don't get up. So you sit there for 4, 5, 6 hours without moving at all. That lack of movement, combined with the peanut butter blood, is what doubles the risk compared to the aisle seat.
Wow.
It's a trade-off between the view of staying alive versus the view of the clouds.
That really puts it in perspective. You are trading a view of the horizon for a significantly higher chance of a medical emergency. And speaking of medical emergencies, I think we needed to ground this in a real story. Because stats are one thing, 1 in 1,000, 3 times risk correlation, but stories, they stick with you. And Dr. Tauth shares a story from his files about a patient he calls Sarah.
This story is just heartbreaking because it was so preventable. Sarah fits the profile we just discussed perfectly. She was 58 years old. She was a heart patient dealing with some chronic issues, but, managing them. And she was taking a big trip, a 12-hour flight to Europe. This was supposed to be the vacation of a lifetime.
So she is right in that danger zone. Over 8 hours, nearing 60, heart history. She's the perfect candidate for this perfect storm.
Exactly. Now, during the flight, she started feeling pain in her leg. And I think so many of us do this, she rationalized it. She's in a cramped economy seat. She's, as Tauth says, scrunched up like a pretzel. So she just assumes it's a cramp.
Backwards.
She thinks, I'm uncomfortable, my leg hurts, that's just normal for flying.
I would think that. I think everyone listening would think that. You just assume it's muscular. You assume it's the seat pitch. You think, I just need to walk it off when I land.
And that's what she did. She ignored it. She suffered through it. She landed. She got off the plane. She felt that relief of standing up and stretching. She made it through customs. Yep. She made it all the way to baggage claim. And that is where she collapsed.
Just right there, at the carousel, surrounded by suitcases.
A massive pulmonary embolism. The clot that had formed in her leg during those 12 hours broke loose when she started walking around the airport, traveled to her lungs, and just shut her down.
Oh, my God.
Now, the incredible part is that emergency services were there fast. Emergency surgery saved her. She survived. But Dr. Tauth points out a very sobering fact. 30% of passengers in her situation do not survive. They don't make it out of the airport.
30%, that's basically Russian roulette, 1 in 3.
It is. And it's so tragic because Sarah didn't know the rules of engagement. She didn't know that as a heart patient, she couldn't just endure the flight. She had to manage it. She treated it like a bus ride when she really should have treated it like a medical event.
So let's pivot to that management. Because the goal of this deep dive isn't to scare people into never leaving their house. Dr. Tauth is very clear about this. Heart disease doesn't ground you, but you have to have a strategy. He lays out what he calls a flight survival strategy. And honestly, even if you don't have heart disease, this sounds like good advice, but for heart patients, it's absolutely mandatory.
Absolutely. This is a checklist. If you are listening and you have a flight coming up or your parents do, write this down, stick it on your fridge.
Okay, item number 1 on the checklist, fashion. Specifically compression socks. Now, I have to ask, are these just tight socks, or is there some real science here? Because I see them at the pharmacy next to the insoles.
There is real science, but it has to be the right type. This is non-negotiable. And we aren't just talking about buying a pair of tight gym socks or those fuzzy socks you wear in winter. No. You need socks with specific medical specs. 15 to 20 millimeters of mercury pressure.
Okay, millimeters of mercury sounds like we're measuring weather or like atmospheric pressure, but that's the pressure rating for the sock, right?
It's a standard unit of pressure. And 15 to 20 is a medical grade for travel. The magic is that it provides a graduated squeeze. It isn't just tight everywhere, it's tightest at the ankle and gets progressively lighter as it goes up the calf.
Okay, so why does that gradient matter?
It creates a pressure differential. It physically forces the blood back up towards the heart against gravity. It's like an external muscle pump. It prevents the blood from pooling in the ankles in the first place. Dr. Tauth calls it a gentle hug for your legs.
A gentle hug that keeps you alive. I like that. And when do you put them on? Not in the bathroom on the plane, right? I imagine struggling into those in a tiny lavatory is a recipe for disaster.
Please don't try that. You'll pull a muscle just trying to get them on. No, you want them on 2 hours before your flight.
Oh, that early?
Yes, you want that compression active before you even get into the high-pressure environment of the cabin. You want to preload the protection, put them on at home before you even leave for the airport.
Got it. 2 hours pre-flight. Okay, item number 2, the aisle seat mandate.
We touched on this, but let's be firm. Dr. Tauth says this is mandatory. He says, I don't care if you have to pay extra, argue with the gate agent, or sweet-talk the flight attendant. If you have heart disease, you need the aisle. You need the freedom to move without asking permission.
It's basically a medical device at that point. The seat becomes part of your prescription. And honestly, most airlines, if you explain you have a medical condition requiring movement, they will try to accommodate you. But you have to speak up.
You have to be your own advocate. Don't be shy about it. Your health is more important than, avoiding a little bit of awkwardness.
For sure. Okay, item number 3, the movement protocol. So how much are we actually moving? Is it just a stroll to the bathroom, or are we, running laps?
Walk every 2 hours.
Yeah.
Minimum. Set a timer on your phone.
Oof. This is the hard one. You're watching a movie, the plot is thickening, or you finally fell asleep after 3 hours of trying.
I know, but Dr. Tauth has a great line for this. Your circulation doesn't care if the movie is getting to the good part.
Ha! I love that.
The biology doesn't pause for the plot. You have to get up and walk the length of the cabin to get that calf muscle pump working. Just walking up and down the aisle once or twice is enough to flush out that stagnant blood.
Okay, walking every 2 hours. Set a timer. Item number 4, hydration. And this comes with a bit of a buzzkill warning.
It does. The strategy is 8 ounces of water every hour. That's a cup of water every hour. That combats the desert dry air we talked about. But the flip side is the ban. You have to avoid alcohol completely.
Oh, come on. That little bottle of overpriced wine is the only thing getting me through the turbulence. Why is alcohol such a villain here?
It comes right back to the peanut butter. Dr. Tauth calls alcohol dehydration in a fancy package. Alcohol is a diuretic. It inhibits the hormone that helps your body retain water. So it actually makes you lose fluid.
Ah.
So you're in a dry cabin, you're losing fluid to the air, and then you drink something that signals your kidneys to dump more fluid.
Yeah.
You were fast-tracking that peanut butter blood scenario.
That's a compelling argument against the in-flight Chardonnay. You're basically turning yourself into human jerky.
Pretty much.
Okay, no booze, lots of water. Item number 5, in-seat exercise. So this is for when you can't get up. Maybe the seatbelt sign is on for turbulence.
Right. Sometimes you can't walk. So every 30 minutes, you do this in your seat. You don't have to stand up. You just need to activate the calf muscles. Point your toes, flex your ankles. Dr. Tauth says to squeeze your calf muscles like you're trying to crack walnuts with them.
That is a very specific image. Cracking walnuts with your calves. I'm trying to do it right now under the desk. I can feel it.
It works, though. That squeezing action pumps the veins. The calf muscle is often called the second heart by doctors because when it contracts, it pushes venous blood back up with significant force.
But let's be real. You might look a little crazy doing this. You're sitting there flexing and grimacing.
You might. You might look like you're doing a weird little dance. But as Tauth says, it's better to be the weird person doing exercises than the person with a blood clot.
True.
Embrace the social awkwardness. It's a survival tactic. Who cares what the stranger next to you thinks? You'll never see them again.
Be the weirdo who survives. I like that motto. And finally, number 6, the pre-flight homework.
This is the step most people skip. Call your cardiologist 2 weeks before any flight over 6 hours. Not the day before, 2 weeks.
Why 2 weeks?
Because you need time to make adjustments. You need a personalized plan. Maybe you need to adjust your meds. Maybe you need a blood thinner just for the trip. You don't know until you ask. The doctor needs time to evaluate and maybe even run a quick test.
It's about being proactive. Dr. Tauth says, maybe I should see you in the clinic. That conversation needs to happen well before you're packing your suitcase.
It's treating the flight like a medical procedure, not just a logistical one. You wouldn't run a marathon without training. Don't take a 12-hour flight with heart disease without a plan.
So that is the plumbing. That's the blood, the clots, the pipes. We've covered how to keep the river flowing. But the heart is a double-sided machine. It's got pipes, but it also has wires. And that brings us to the second part of our deep dive today, the wiring.
This is often where people get even more confused. We understand clogged pipes. We understand plumbing because we have sinks in our houses. It's intuitive. But when we talk about the electrical system of the heart arrhythmias, it feels more abstract. It feels, invisible.
Right. So let's define terms here. Our source material, the Heart Rhythm and Cardiology Patient Guide, breaks this down beautifully. What exactly is an arrhythmia?
In simple terms, it's a malfunction in the heart's timing mechanism. Your heart has a natural pacemaker, it's called the SA node, that sends electrical signals to tell the muscle when to squeeze. It's like a conductor in an orchestra.
Okay.
The conductor taps the baton and says, "Now," and the entire orchestra plays in perfect time. When that conductor gets confused or when someone else in the orchestra, like a tuba player in the back, starts trying to lead, that's an arrhythmia.
I love that image. A rogue tuba player causing chaos. And this rhythm problem can go fast or slow, right? It's not always one or the other.
Correct. If it's too fast, we call it tachycardia. Think of a tachometer in a car revving high into the red zone. If it's too slow, it's bradycardia. And sometimes it's just plain irregular chaotic. The beat isn't steady. It's skipping, jumping, fluttering.
Now, everyone has felt their heart skip a beat. Maybe you're nervous or you drank too much coffee or you almost step off a curb into traffic. When do we worry? What are the symptoms that say, this isn't love and it isn't espresso, this is a medical problem?
The guide does a great job distinguishing between common mild symptoms, the real red flags. Common symptoms are palpitations, that fluttering feeling like a bird in your chest, or a racing heartbeat, a sensation of skipped beats.
Okay, but are those dangerous? Because I feel that when I watch a horror movie.
Not always.
Yeah.
Palpitations alone aren't always a cause for alarm. The guide is very clear on that. However, the context matters. The red flags are when those palpitations are accompanied by other things.
Like what?
Fatigue, dizziness, fainting, shortness of breath, chest pain, sweating.
So if my heart flutters while I'm watching a scary movie, that's probably just adrenaline.
Right.
But if my heart flutters and I feel like I'm going to pass out while I'm sitting on the couch reading a book, that's a problem.
Exactly. If it affects the function of the heart, meaning if the rhythm is so bad that the heart isn't pumping blood effectively to your brain or your body, that's when you get the dizziness and the fainting. That is immediate medical attention territory. That means the pump is failing because the wiring is shorting out.
What causes the wiring to go bad? I mean, is it just bad luck or did I do something wrong?
It's a mix of a lot of things. There are internal causes, congenital pathways you were born with, extra little wires that just shouldn't be there, or scar tissue. If you've had a heart attack in the past, that scar tissue acts like a, concrete wall in the middle of a highway. The electrical signal hits it and has to detour, which causes chaos.
And external stuff. Can stress literally break my heart's wiring?
Lifestyle plays a huge role. Stress, anxiety, caffeine, and hormones, for sure. Also, high adrenaline. The sources mentioned that high adrenaline during an illness like when you have the flu or a bad infection can trigger irregularities.
Oh, interesting.
It's like a power surge hitting the system. Your body is under stress, it pumps out adrenaline, and that overstimulates the heart's electrical system.
Power surge. That's a good analogy. And I assume getting older doesn't help. Things just tend to wear out.
Sadly, no. Aging, obesity, smoking, diabetes, these are systemic issues that degrade the wiring over time. The insulation on the wires gets worn down, so to speak.
So if the wiring is bad, what can be done? Are we just stuck with a flickering light bulb? Do we just have to live with it?
No, absolutely not. The treatment spectrum is amazing now. The goals are threefold, really. Prevent clots, because irregular beating can cause blood to pool in the heart chambers, just like in the legs.
Same mechanism.
Same mechanisms.
Yeah.
Then you control the rate. And finally, you try to restore the rhythm.
And the tools to do that.
Medications are the first line. We have drugs that act like speed governors on a car. But then you have procedures. For slow beats, bradycardia, you have pacemakers. They act as a backup generator. If the natural conductor falls asleep, the pacemaker kicks in and keeps the beat.
And for the fast ones, the tachycardias.
For the fast or irregular beats, there's a procedure called cardiac ablation.
Ablation sounds intense. It sounds like something from a sci-fi movie.
It does sound scary, but it's actually minimally invasive.
Yeah.
They go in with a catheter through a vein in the leg, no open chest surgery, and they map the heart's electricity. They find that rogue tuba player, and they essentially burn or freeze that tiny spot of tissue that is misfiring. It's like finding the one short-circuited wire in your entire house and just spot welding it. It's incredibly precise.
It's amazing what they can do. And then there are the defibrillator.
Right. For the really life-threatening cases, there are implantable defibrillators. These are like having a paramedic installed in your chest 24/7. If your heart stops or goes into a fatal rhythm, the device shocks it back to normal instantly.
It's just incredible technology, but, and that's a big but, you can't get any of this fixed if you don't know who to talk to. You can't just walk into a hospital and yell, "Ablate me!" And this brings us to the final section of our deep dive, navigating the system.
This is the part that frustrates patients the most, I think. You have a heart problem, so you go to a cardiologist. But cardiology has become so specialized that saying, "I need a cardiologist" is like saying, "I need a contractor."
Right.
Are you hiring a roofer, a plumber, an
Okay.
electrician, a landscaper? If you hire a plumber to fix your roof, you're going to have a bad time.
Exactly. The patient guide provides a menu of cardiology subspecialties. And I think this is so helpful because most people don't know these distinctions even exist. They just see cardiology on the door. So let's break down the menu. Who are the players?
Okay, first you have general cardiology. Think of them as the quarterback of the team. They handle the broad diagnoses, high blood pressure, heart failure. They manage the overall game plan and call the plays. They're often your first stop.
Okay, the quarterback. Makes sense. Who's next?
Then you have interventional cardiology. These are the plumbers. They deal with the pipes. If you have a blocked artery and need a stent, you see an interventionalist. They do the catheter-based procedures to open up the flow. If you're having a heart attack, this is who you want.
The plumbers. Got it. Pipes.
Then, relevant to our last section, you have electrophysiology. These are the electricians.
Ah, the wiring guys.
The wiring guys. They deal with the rhythm disorders, AFib, ablations, pacemakers. If your wiring is bad, you don't call the plumber. You call the electrician. An interventionalist might not be the best person to treat a complex arrhythmia, just like a plumber isn't the best person to rewire your fuse box.
That distinction alone probably saves patients so much wasted time and frustration. And there's one more, right?
Yes, preventive cardiology. These are the strategists. They focus on risk factor modification before the disease strikes or gets worse. They work on lifestyle, lipids, genetics. They try to stop the war before it even starts.
I like that. The strategists. So you figured out which type of doctor you need. But how do you know if the specific doctor you found is any good? The guide mentions checking credentials.
It does, and this is so important. You want to look for board certification. This isn't just a fancy certificate on the wall. It means they passed rigorous exams and completed a 3-year cardiology fellowship after their internal medicine residency. It's a stamp of quality and training.
It means they've put in the hours.
Thousands and thousands of hours.
Are there red flags? I mean, besides a bad bedside manner, how do I know if I should maybe run the other way?
The guide lists a few crucial ones. Obviously, a lack of board certification is a huge red flag. But also communication style. If a doctor is dismissive, if they don't listen, if they interrupt you constantly, that's dangerous.
Why dangerous?
Because you need a partner, not a dictator. You know your body better than anyone. If they dismiss your observations, they might miss the diagnosis.
That makes sense. And there's a financial red flag mentioned too.
Yes, be wary of a doctor who pressures you into unnecessary, expensive procedures immediately, especially if it feels like a sales pitch. If they say, "We need to do this expensive scan right now," without explaining why or trying more conservative measures first, be cautious. Good medicine is about what the patient needs, not what the clinic needs to bill.
That is such important consumer advice. We often forget we are consumers of healthcare. We have the right to shop around. We have the right to a second opinion.
Absolutely. Never, ever be afraid to get a second opinion.
So you found the right doctor. You have the appointment. How do you prepare? Because Dr. Tauth and the guide both emphasize that the patient has a job to do here. You don't just show up and say, "Fix me."
Right. You have to be a good patient, which really just means being an organized patient. Doctors are detectives, but they need clues to solve the case.
So what does that look like in practice?
First, bring a current medication list. And don't just say, "I take the blue pill," or "I take the one for blood pressure." Know the names and the dosages, or better yet, just bring the bottles with you.
The little white one is not a medical term.
It is not. There are 1,000 little white pills. Second, and this is crucial for arrhythmias, bring a written timeline of symptoms. When did the fluttering start? What were you doing? Did you faint? Did you just eat a big meal? Writing it down beforehand is so much better than trying to remember it when you're nervous in the exam room.
That's great advice because the moment the doctor walks in, your mind just goes blank.
It's called white coat hypertension, or just plain anxiety. Having it written down ensures you don't miss the important details. And family history. Bring those records. Genetics are huge in heart health. If your dad had a heart attack at 50, your doctor needs to know that.
And what about the actual interaction? The guide suggests asking specific questions.
Don't be afraid to interview your doctor. This is a job interview, and you're the one hiring. Ask, what is your experience with my specific condition? How many of these procedures have you done?
Mm-hmm.
Ask about their philosophy on shared decision-making. And ask a very practical one. How do you handle after-hours emergencies?
That's a good one. You don't think about that.
You don't. But if your heart goes out of rhythm at 2 a.m. on a Saturday, you need to know who you're calling. Is there a number? Do you go straight to the ER? You need a plan for the off hours.
That is a flight plan for the ground.
Yeah.
So looking at the big picture here, we've covered a lot. We've gone from the lazy river of blood at 30,000 feet to the electrical wiring glitches, and finally to navigating the whole medical maze.
It really is a comprehensive view. And if we tie it back to Dr. Tauth's message, it's all about agency. It's about not being a passive victim of your physiology.
Prevention beats treatment every time. That's the mantra.
Exactly. Whether it's wearing those compression socks, the gentle hug, or doing your calf exercises like you're cracking walnuts, or researching your cardiologist board certification, these are all active steps you are taking control.
And let's remind listeners where this wisdom comes from. We've mentioned him a few times, but Dr. Jeffrey Tauth is really dedicated to this kind of patient education. He's based in Hot Springs, Arkansas, but his reach is obviously much wider thanks to the internet.
Yes, he has a massive commitment to answering questions and making this stuff accessible. He realizes that a 15-minute appointment just isn't always enough time to explain everything.
Right. So if you want to dig deeper into his advice, or maybe check out those juicy details we mentioned, and hear his specific take on things, you should check out his YouTube channel. It's called the Dr. Jeffrey Tauth Heart Talk Show. He does these Q&A sessions there that are really informative, where he takes real patient questions and just breaks them down.
It's a great resource because it feels like a conversation, not a textbook. And for a central hub of all this information, you can go to his website. It is drjeffreytauth.us.com. That's drjeffreytauth.us.com. All the resources are right there.
And as Dr. Tauth said in the clip we reviewed, for some of you listening, the internet isn't enough. If you are hearing these symptoms, the fainting, the dizziness, or if you have that high-risk flight coming up, the best step is a clinic visit. As he puts it, maybe I should see you in the clinic.
Don't delay that. If you're in the Hot Springs area or can get there, seeing a specialist who prioritizes education is just invaluable. But regardless of where you are, find a doctor who listens to you.
So here is the final thought I want to leave you with today. We spend weeks, sometimes months, planning our vacations. We pick the hotel, we research the restaurants, we pack the perfect outfits, we obsess over the itinerary, we know exactly what museum we're going to at 10 a.m. on Tuesday. But how much time do we spend planning the itinerary for our blood?
That's the question, isn't it? We plan all the fun, but we ignore the engine that makes the fun possible.
If we put as much planning into our cardiovascular health, our own flight plan for our body, as we do into our vacation itineraries, how many of these emergency landings could we actually avoid?
I think we could avoid a lot of them. And like Sarah, we could make sure we not only arrive at our destination, but truly enjoy it instead of seeing the inside of a foreign hospital.
Safe travels means smart travels. Thank you for joining us on this deep dive. Check your wiring, keep your plumbing flowing, and we will see you next time.
Stay healthy.